Welcome back. In commemoration of World AIDS Day, UNAIDS has released a report titled Prevailing Against Pandemics by Putting People at the Center. It's calling on countries to make greater investments in global pandemic responses to reach what it calls achievable lower HIV infection targets. UNAIDS says if these are met, the world will be back on track to ending AIDS as a public health threat by 2030. Interim Director for the UNAIDS Regional Support Team for Eastern and Southern Africa, Aeneas Chuma, is joining us now to unpack this. Mr. Chuma, good morning and thank you very much for your time. But when you look globally, there's been hope, but COVID-19 must have presented some setbacks for the fight against HIV/AIDS.
Yes, definitely. And good morning, and thank you for your interest in our work. I think, COVID-19 has had, is disrupted, in fact, a lot of livelihoods and lives. And for us working in the HIV response, it has basically, for example, disrupted services, disrupted access to services, particularly during the lockdowns. And it has seen in some cases the redeployment of limited resources away from the HIV response to respond to the pandemic. But I mean, that's really what has happened. But by and large, I think governments have recognized this and they've been able to continue to make sure that the HIV services are provided, even as they face limited resources and limited technical.
How big a setback has COVID-19 brought upon programs to fight HIV/AIDS? Can the world recover from that and continue to make progress towards eliminating or controlling the levels of HIV infection rates by 2030?
I think the impact has been quite but manageable, as it were. By and large, even before COVID-19 hit, generally the world was behind in terms of off track in terms of achieving the goals that had been set for 2020. I think what is now happening is that we're resetting that, come up with much more realistic goals, much more targeted interventions, particularly for those that have been left behind by 2025. But this thing is not going to happen on its own. There is need for concerted effort. There is need for joint work and recognition that COVID-19 response need not replace or divert resources away from the HIV response.
Yeah, but striking that balance is going to be tough because, as you said,
yes.
There's a lot of resources that are needed. But to achieve lower HIV infection targets, in your view as UNAIDS, what would countries need to do? What, for example, a country like South Africa, we understand we remain with the highest number of people living with HIV in the world. What would we need to do differently towards 2030 from now? Still, of course, understanding the competition for those resources that have been brought on by the coronavirus pandemic.
I think what countries need to do is not to make a choice between HIV and COVID. They need to invest in the health systems, and they need to consolidate some of the gains from the HIV response. Resources will be crucial, both financial resources, but also technical resources in terms of health workers and in terms of the infrastructure that supports the response. So you need a structured response that looks at both the needs of responding to the COVID-19 and the needs to continue the type of services that have been provided, to support the HIV response. So it's really requires, for example, better coordination between the various ministries of finance themselves that make resources available, and the ministries of health and the capacity of the health system to continue to provide support while they're containing the COVID-19.
Yeah, because as you said correctly in the report, we have to put people at the center of the pandemics. And sadly, the world, we're facing the new pandemic, COVID-19, but HIV/AIDS has been with us for years and does not seem to be going away.
Yes, it doesn't seem to be going, but it can be contained. Okay, we don't have an HIV vaccine, as it were, but over the last 3 decades or so, in a lot of cases, HIV spread has been contained, but it doesn't happen on its own. It requires continued vigilance in terms of preventing new infections, as it were, in terms of continuing access to medication, and also continuing prevention activities that have been happening over the last 3 decades and going forward. So it's all related, and I think one of the strengths is that most countries do have programs of fighting and providing treatment and providing prevention services across the board. But they still face challenges in terms of the vulnerabilities that come from inequality, from gender-based violence, and the economic challenges that have emerged as a result of disruptions to the economy from COVID-19.
Okay. Finally, what gives you confidence in the UNAIDS, in the work that you do, that progress will be made to end HIV/AIDS as a public health threat by 2030?
Well, UNAIDS has been championing the HIV response for the last 35 years or so. We've learned a lot, for example, focusing on communities in terms of the response, and looking at issues that, for example, promote the spread of HIV that need to be addressed, such as inequalities, such as negative masculinity, gender-based violence that we see, the vulnerability of adolescent girls and young women that need to be addressed, and making sure that service is available to test, not just to test, but to provide support and medication to those that need it, but also equally invest in prevention. Prevention is extremely important, but it requires often change in behavior, and that takes a long time to manage.
Yes.
But we do have experience over the years, and we just need to consolidate and scale up, in terms of the coverage.
Yeah, and that change in behavior has been highlighted by South African authorities ahead of today, asking all of us in South Africa and South Africans, people who live here, to make the right health choices. Thank you very much for your time this morning on World AIDS Day. Keep on doing the good work, UNAIDS, that you are doing as you try and get us and the rest of the world to make sure that we end HIV/AIDS as a public health threat by 2030. At least some progress is being made, though COVID-19 has had some impact. Thank you very much. That's Aeneas Chuma. He's the Interim Director of UNAIDS and Regional Support Team in Eastern and Southern Africa.